Hello, welcome here ANA community. From this past several videos, we are going to discuss how we are going to take the case history in the clinical setup. We have started with chief complaints. This is being followed by history of present illness, past history, treatment history, family history, personal history, menstrual and obstetric history, and social history and environmental history. In this particular video, we are going to discuss the occupational history. How this occupational history will be giving us the overall idea of the health status of an individual as such. Whenever we say about the occupation, this is nothing but a person's repeated activities that too doing in a particular setup or setting. That is nothing but a professional work of an individual, which may be either 8 hours a day, 6 a week, or 24 into 7 days into 365 days, just the businessman, etc. And this may be related to whether the person is doing the sedentary activity or physically straining activity or mentally straining activity, etc. That has to be inquired there. As far as occupational history, so you are supposed to write what kind of the environment he is going to get exposed. Whether is it physical environment or psychological environment. When there is physical environment, naturally, so that may be responsible for the Sharirika dosha involvement, whereas psychological environment that may be responsible for the Manasika dosha involvement or the Manasika dosha balance or imbalance that can be observed. So here are the following points: current occupation, job duration, work environment, hazards and exposures, protective measures, work schedule, previous occupations, occupational injuries and psychological factors, etc. and occupational health screenings. These are the different points which are helpful in analyzing the person's physical status as well as psychological status. Coming to the current occupation. So in this particular situation, see this, the person is actually doing the seeing the microscope as such. So that means he will be having, if the person is having the occupation, most commonly he may have the vision related problems or the person may have headaches as such. In this particular second example, where the person is doing the cleaning work as such, he is more prone to have the either respiratory diseases or if he there may be a possibility of a dermatological illnesses. Why? Because he is actually wearing the gloves and sometimes the gloves are considered to be allergic to that particular individual, some of the individuals. In that way, the person may have the development of the diseases as such based on the current occupation. Whereas in the third example, see this, he is doing the, what you say that he is having the cooking profession. In the sense, he is more exposed to the, what you say that the fire or gas. So that means he is more prone to have Ushna Guna increase in the body. In that particular sense, the person may develop pitta dominant diseases in due course of time. In that way, the current occupation will be helpful in diagnosing the diseases as such. As far as job duration is concerned, see this particular image, he is actually having the work of what is it that doing the welding. That means he is actually welding the what is it that the metals as such. So that means if he is having the duration of more than 10 hours, Definitely, so that he is more prone to have the exposure to Ushna Guna. Thereby, the person may have Pitta dominant disease as such. Whereas the second occupation, wherein if he is having a driving as a profession, and if he is considered to be driving the vehicle for long drive, most common the presenting complaint the person may develop will be constipation or alimentary canal disturbances as such because of the change in their routine diet as such. The person may develop diarrhea or constipation. In that way, the job duration may have an importance in the manifestation of the diseases or diagnosis of the diseases can be done. See this. As far as work environment is concerned, this is the environment where the person may have mentally stress as such. That means, look at this from morning 8 o'clock till 8 p.m. In the sense, continuously monitoring the computer, naturally that may have an additional mental stress. Whereas, look at this particular image, he is actually doing the physical activity. So that means this may lead to physical induced stress as such as the person may have the calf muscle cramps or the increased pulse rate, where thereby the person may have the mobilization of fat, adipose tissue into the circulating tissue. Thereby, the person may have atheromatous plaques development, etc., that can happen there. In this way, the work environment may have an impact on the progression of the disease or pathogenesis as such. As far as occupational hazards and exposures. In this particular example, if the person is doing this kind of the uh, occupation, then look at the dust that is going to get come out, and if the person is inhaling those dust, is more prone to have respiratory allergic manifestation. Whereas this particular image, where the person will be exposed to psychological stress. So that means he may have the, the anxiety or sleepless nights, etc., that can be developed. As far as the previous occupations are concerned. So regarding the doctor, regarding the previous hospital occupation details, what kind of the work environment was there in the previous hospital, etc., that can be analyzed there. Whereas the attaining the judge, previous occupation of a lawyer, so that will be helpful in determining the psychological stress as such. Whereas attaining the post of principal, previously having an occupation of professor as such. So earlier it was only related to academic work. Now he is exposed to administrative works also. So this may have a totally different way of psychological stress as such. Pizza delivery boy, previously having an occupation of cook. Previously he is cooking, having the cooking profession. That means where there may be a possibility of exposure to fire, etc. If we pick the dominant diseases, later he is actually switching his profession to pizza delivery, etc., where there may be a possibility of a author dominance itself. Clerical job in an office, previously having an occupation of heavy vehicle driving. So that means previously he was having the probability of developing the constipation. But in this particular clerical job, he is having the total sedentary lifestyle. Thus, this may have an impact overall the health status of the individuals. For this reason, previous occupations and related to the informations of previous occupations is important. as far as occupational injuries are concerned. See this is a sports where the person will be having the uh, more and more chances of developing the sports related injury. For example, the lacerated wound on the skin, or the fracture of the bone, or severe blood loss from the body if there is any artery is being cut or vein is being cut. So in this way, if the people are having the occupation of this as their professional sports, they are more prone to have such kind of the uh, sports related injuries. Whereas the other one, wherein the person or lady is exposed to severe mental stress. In that way, that may be responsible for the reduced food intake, etc. Thereby, the person may develop emaciation related problems. As far as occupational health screening, in the sense, so that means we are going to interact with the people who are working in the factories or who are working in the agriculture, etc. And we are going to see what kind of the diseases they are suffering from. And is there any specific prone for certain diseases? As such, we are going to check that. For example, in this particular example, they are more frequently to have the exposure to dust, etc. So that means here the health screening will be done to check the status of their respiratory allergic manifestation. As far as psychological factors are concerned, when you say about psychological factors, so here see the if the person is exposed to this particular computer for longer time duration, naturally, so that will be having an impact on the psychological, that is, as well as emotional well-being. Whereas in this, look at this. If the person is exposed to this kind of the phenomena where one person is actually giving you the what do you say, that the details to be done, work to be done, etc., imposing the work to be done, naturally the persons who are listening to them may develop psychological stress if they are not loving their work. So these are the different ways wherein occupation plays a role in actually having a health analysis of the individual, or in analyzing the occupational diseases and hazards. So the take-home messages from today's discussion are: occupational history actually gives us the details about the occupation in terms of the timing of the work, in terms of the nature of the work, duration of the work, impact on physical and mental health as such. As far as occupational health hazards can be diagnosed, for example, respiratory allergies in the persons who are working in the agriculture sector, having the severe pain in the back, headache, etc. in the IT professionals. And psychological factors has to be analyzed to know about the degree of emotional involvement. So for all these, occupational history, a detailed occupational history is important. Dear ANA members, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one topic that you'd like to hear in the coming videos? Mention in the comment box below. And if you are liking this particular video, then put a thumbs up and spread this particular video to maximum number of true Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.